All right, so last month, the name of a condition that affects 1 in 8 women worldwide was changed, or I should say updated. The condition was called PCOS, polycystic ovarian syndrome. You've probably heard of it. It's often brought up when women have issues getting pregnant. And the name was inaccurate. It was wrong enough that 70% of women who have it went undiagnosed. I think I just want to go over kind of the story of how it came to be, why it was misnamed, and what to look forward to now that we've updated the name, which also is going to change how it's treated. So how did we end up here in 2026 with an inaccurate name for almost 100 years? So it all started in 1935 or 34 with two American doctors at a medical conference. They presented a paper about the 7 women. They all had the same problems. They had irregular or absent periods, excessive hair growth, ovaries that looked enlarged, thickened, and what appeared to be covered in small cysts below the surface. So when they connected these dots together, they published this paper and they called it amenorrhea associated with bilateral polycystic ovaries. And that word polycystic really stuck. Poly meaning many, cystic meaning cysts, many cysts of the ovaries. So that's what they saw, and that's what they named it. And when you look at what a cyst actually is, they're not, in this condition, they're not really cysts. So a cyst is a closed sac. It's filled with fluid or other material that shouldn't be there. When you look at an ultrasound of someone with this condition, you see something different. They're actually egg follicles. So these are the same eggs that develop every month as part of a normal menstrual cycle. Except in this condition, these eggs don't complete their development. They get stuck or arrested at an early stage because of hormonal disruption happening elsewhere in the body. It's not just in the ovary, right? But you're seeing the downstream effects in the ovary. So the normal follicle normally should mature, then ovulation occurs. But in PMOS, now the new name, it starts developing, then it stops, and that stopped development looks like a cyst on the scan. So, like I said, the ovary is just showing you the symptom of a problem that starts somewhere else entirely. It's not a purely ovarian or gynecologic issue here. All right, so the name was wrong. They weren't really cysts. They're actually eggs that stopped in development. Is that such a big deal? Yes, and I'm going to say why here. So these women who were diagnosed with PCOS were generally given birth control to manage their periods and sent home. That's it. You manage the reproductive symptom and ignore everything else. And if you're not trying to get pregnant, then you're being one of the 70% who's being missed. But what I want to talk about is what's happening elsewhere in the body at the same time. So you're going to see here that, it's not just the ovary. If you expand, you'll see that it's you also have insulin resistance in 80% of these patients. So that's a metabolic problem. Insulin resistance you might recognize from diabetes, type 2 diabetes. They also have cardiovascular risk numbers that are much higher. Looks more like cardiology. And when you look at other things, you could see skin issues. There's some mental health issues in here too as well. So it's really not a gynecology condition that does some other things. It's actually a whole body metabolic disorder that also affects the reproductive system. So it's really turning it backwards. When you call something polycystic ovarian, general practitioner will send to a gynecologist. Gynecologist treats the ovary, and nobody orders a metabolic workup. So that's why 70% of PCOS patients went undiagnosed globally. And it's, again, not because they didn't have symptoms and people couldn't see the signs. It's that nobody was really looking for them unless they're trying to get pregnant. And just for a quick comparison that makes it clear, so men also have a condition called benign prostatic hyperplasia, BPH. This is a prostate issue. So it used to be called BPH, benign prostatic hypertrophy. They renamed it hyperplasia, which is the same acronym. But the difference is that hypertrophy is your cells are getting bigger. So like when you lift weights or something, your muscles will hypertrophy. Actual cells get bigger versus hyperplasia, where there's just a bigger number of cells. So both things might look similar, especially when you're thinking of the prostate. The prostate has enlarged, but it's not that each individual cell has enlarged. There's just more cells. So that was a tiny change, but the science demanded it, and they did change it. So what's happening now with PCOS is the same thing, except the gap between the old name and the new name is a lot bigger. Not only did the acronym change, but even the treatment's going to be different. All right, now let me talk about what's actually going to change. Let me talk about the new name. So the new name was chosen by a committee of like 56 organizations. Took 10 years to do so. I'm going to go word by word here. So the first word is polyendocrine. So this is multiple hormonal systems, not just the ovary. This includes insulin, androgens, stress hormones, all of these. The second word is metabolic. Now, this is the biggest addition. So this brings in like your blood sugar, brings in cardiovascular issues, weight, inflammation. So since it's in the name now, it should belong in the workup. The third word is ovarian. Yes, it is still there because the ovaries are affected. But now here it's downstream of the problem, not the cause of the problem. And the last word is syndrome. I don't think I need to explain syndrome too much. All right, so finally, if you are watching this and you already have a PCOS diagnosis, or you've been trying to conceive and not being able to get pregnant, bring this information to your next appointment, not the video, but the new name PMOS, polyendocrine metabolic ovarian syndrome. You can ask your doctor about a full metabolic workup. I think, don't think you're being a difficult patient. And if you know someone who has PCOS, a friend, a sister, or someone who's been through the whole fertility system and come out without clear answers, you could send this video to them or give them some additional information. This video doesn't have all the answers, but I tried to kind of set it up so you'll know a little bit more and hopefully be able to ask the right question to your doctor and get the help you need. Thanks.